Hello all, thank you for joining this presentation today. I apologize that I was unable to be there in person, but I am definitely happy to share this information on effective advocacy for nursing and influencing legislation. My name is Tiffany Winter, and I am the Deputy Executive Officer of Government Relations and Professional Engagement at the Ohio Nurses Association. I've been at ONA for about 2 years, and I've served in a few different roles here. But one of my passionate things that I really enjoy doing for the association and for our profession is getting members engaged in health policy and realizing why it's important for us to be involved and to move our profession forward. So currently, we are in the 131st General Assembly. And the way that the General Assembly is set up is that there are 99 members of the Ohio House of Representatives and 33 members of the Senate. The way the districts are set up is that one Senate district will make up 3 House districts. So senators will represent more of their constituents than the House of Representatives will. So currently, there are 65 Republican House members and 34 Democrat House members, and 23 Republican senators versus the 10 Democrat senators. So all of this we really have to take into account when we're talking about moving legislation forward for our profession. It's important to know who is really getting things done in the State House and how majority versus minority affects the way that legislation passes through the State House. The party with a majority of the members in each chamber has a responsibility of organizing that body for a 2-year period, and that 2-year period is called a legislative session. So in January of 2015, so about a half a year ago, we came into this new General Assembly, which is the 131st. So we're about halfway through the first year, and then we've got a year and a half left of this legislative session. So bills that are introduced from January 2015 through that 2-year period, but are not passed in that 2-year period, have to be reintroduced and started at the beginning of the process in the next legislative session. Something that I always really like asking people to kind of make it a point to show why it's so important to be involved in our profession and to be an advocate for our profession is because of the flavor of the State House and the way the House and the Senate is made up. So out of the 99 members of the House and 33 members of the Senate, I always like to ask, how many of those members of the 99 and 33 do you think are physicians? How many of them are doctors? Well, there are actually 2. We have Representative Terry Johnson and Representative Steve Huffman. Both of them are physicians. And again, out of those 99 and 33, how many of them do you think are pharmacists? There's actually one pharmacist who works in the current General Assembly, and that is Senator David Burke. And out of those 99 and 33, how many of them do you think are nurses? Well, the answer is 0. So currently, out of the 99 members of the House and the 33 senators that we have, none of them are registered nurses. That means none of them have gone through nursing school. None of them have stayed up late writing care plans. None of them have gone through clinicals for the first time. None of them work at the bedside. And that's extremely important to realize because those 99 and 33 members of the House and the Senate are the people who are creating the laws that dictate what we can and can't do as registered nurses in the state of Ohio. So hopefully that's a red flag to all of you to know that that's why it's extremely important for RNs to be involved in the legislative process. So how do legislators get ideas? Well, several ways. Some of them have a legislative background or may come from families who had parents or grandparents who worked in the General Assembly, and maybe they were really passionate about something. Or it could be a district issue. So we've had a couple of things come up that ONA has worked on dealing with Lyme disease. So there are certain parts of the state of Ohio that actually have a higher viewpoint of Lyme disease. And so legislators from those specific districts see the amount of Lyme disease cases and see that they might need to do something legislatively. It could be a constituent issue, so maybe something comes up that a constituent might bring to a legislator to say, hey, I think we have a problem with this. Can we do something about it? Then there's special interest or lobbying groups, and that's where ONA kind of falls into place. We are a special interest group because our profession is regulated by the House and the Senate and by the Board of Nursing. And the majority versus the minority parties and the House versus the Senate, both of those things mean you have to take into account what the flavor of the makeup of the House and Senate are. So, for example, obviously, in the current General Assembly, the Republican Party is the majority. And the majority party is always key to have on your side when you're trying to get bills passed through the State House. The House has tended to move a little bit more quickly than the Senate until recently, and the Senate's really trying to move things through at an expedited process as well. So the written word. Not all legislators are attorneys, so how do they draft language? There are a couple different avenues to do that. There's the Legislative Service Commission directly across the street from the State House, and it's a body of people who know the revised code and the administrative code, and so they are able to use that knowledge to help legislators write language that could change the way our laws are set up in Ohio. And so they're strictly there to help that process. There's also model legislation that can start with one interested party group or in one specific state, and it can go state by state by state to have this model legislation introduced within each state. An example of this would be diabetes care in children in the school setting. So about 2 years ago, I heard about a piece of model legislation that was going state by state by state. It hadn't hit Ohio, but eventually it did about 6 months after I first heard about it. And that model legislation talked about how children would be taken care of in the school setting if they had diabetes. Now, something to keep in mind with model legislation is that laws that work in one state may not work the same way in another state. So, for example, our friends in Pennsylvania, they have registered nurses in every single school. By law, they are required to have that. So the way that diabetes care is taken care of in Pennsylvania is different than what it would look like in Ohio. In Ohio, it's not required that we have a registered nurse in every single school. So model legislation, again, can be tweaked depending on what state you're in. Pieces of legislation have multiple drafts. It's about people working together, interested parties working together, and making sure that that last piece of legislation that's passed through is the way that it should be. Then the bill is sent to a committee once it's drafted, and it's given an assigned number. So the way that the committee process works, and I like to say the committee process is kind of where everything goes down. These committees are organized on the basis of subject area. So a lot of the issues that ONA follows are in health committees in the House and the Senate. Some of the other things we may follow might be in committees such as finance, commerce and labor, workforce development. But again, a majority of the bills that we follow are in House Health and Aging, Senate Health and Human Services, or Senate Medicaid. Prior to this General Assembly, the Senate Health and Human Services and the Senate Medicaid were actually combined as one committee, but the state has really been doing a lot of work with Medicaid expansion and extension, and so they were given their own committee this year. So once the bill is sent to the committee, it has to go before the committee and be heard. But each committee is headed by a chairman from the majority party, and it's really, really, really important to know who the chairperson for each committee is and to become, quote unquote, friends with them so that you can help get your legislative proposals through the process. So for example, the House Health and Aging Committee is chaired by Representative Ann Gonzalez. The Senate Health and Human Services Committee is chaired by Senator Shannon Jones. And the Senate Medicaid chairperson is Senator David Burke, again, who is the pharmacist. And I should mention here, too, that Representative Huffman and Representative Johnson, the two physicians who work in the General Assembly, also sit on the House Health and Aging Committee. The number of majority and minority members depends on the size of majority relative to the minority. So, for example, what that means is if we have in overall the General Assembly, there's 60% Republicans versus the 40% Democrats, that's the way the committee is set up. You'll have 60% of that committee being Republican and the 40% being the Democratic Party. Again, try to become friends with the committee chair people because they're the people who set up the agenda for each committee that's heard. So, for example, if O&A is working on an issue and we want to get on the agenda and we have a bill that we've brought forward, we need to talk to the chairwoman, Ann Gonzalez, to make sure that we're on her radar and to make sure our bill is heard in that committee. After the bill is assigned to a committee, the sponsor presents the broad outline of the legislation to the committee. So for a bill to actually move through the legislative process, it has to receive at least 3 hearings. The first hearing, again, will be the sponsor testimony. So the sponsor of the bill will get up and talk about why that bill is important, how it changes law in Ohio, why it's needed, if there are any financial implications attached to it. And the committee people will have the opportunity, the members, to ask questions of the sponsor. And the sponsor can then try to find those answers and come back to the committee later on. The members of the committee have, again, the opportunity to ask member questions about the bill what the bill proposes to do and the impact it will have on Ohioans. And then at successive hearings, proponents of the bill as well as opponents have the opportunity to testify as well as answer questions about the legislation. Amendments to the bill are usually adopted to respond to the questions and the concerns of the committee members. So again, for a bill to move through that legislative process, it first has to have sponsor testimony, then it has to have proponent testimony, and possibly opponent testimony. And if there are no additional questions and the bill is ready to move through the legislative process, the members of the committee will actually take a vote. And if the majority of the members agree with the legislation at the end of this process, the bill is voted out of committee for consideration by the entire House or the entire Senate. If the bill is not moving through the legislative process, and say it doesn't have proponent or opponent testimony, the bill will die in committee and never move beyond the committee process. So it will never become a law in the state of Ohio. But by law, every bill must at least have sponsor testimony. So as the bill has its hearings in committee, and the committee then votes on it and it passes out of the committee, if it's on the House side, it will go before the full House for a vote. And if it has the majority vote of the House, then it has to bump over to the Senate, and it has to go through the same committee process on the Senate side. If the Senate side makes changes to that bill, the bill has to then go back to the House for concurrence. So you can see that even though there's a 2-year window, it does take quite a bit of time for legislators to work through the process to make sure that both the House and the Senate concur on any changes made to the piece of legislation. But then the legislation, if passed by both chambers, both the House and the Senate, then it will become law and it has to be signed by the governor. As the process continues, we're now in the rulemaking process, especially when we're talking about legislation that affects registered nurses. So the rulemaking process is the responsibility of the executive branch, and it's granted rulemaking authority by the legislature. So the legislature passes the law, and then it trickles down to the rulemaking. So you must adhere to the administrative procedures set out in the law, And the law, I like to think of the law saying what and the rules saying how. So the laws tell you what you can and can't do as a registered nurse. And then the Board of Nursing comes along and tells you the rules on how you have to follow that law. So the rules do have force and effect of law. So if you're not following the law and you're not following the rules, your license can be revoked as a registered nurse. I also like to mention here the difference between the Ohio Nurses Association and the Ohio Board of Nursing. There are a couple of distinct differences between the two. So ONA, who I work for, we are a professional association. You have to have membership in order to belong to ONA. We have a board of directors, and those board of directors are actually voted on at our biennial convention by our members. So the members are voting on who our board of directors are. And our mission and our goal is to advance the profession of nursing and moving the profession of nursing forward in Ohio. The Ohio Board of Nursing is a regulated body, and they are given their regulation through the legislature and through the governor. So in order to be a board member on the Ohio Board of Nursing, you actually have to be elected by the governor himself. So how that works is if there's a board seat that's open on the Ohio Board of Nursing, members of ONA can actually submit paperwork to ONA. It goes to our Committee on Qualifications, and we make recommendations to the governor's office on behalf of the association, and we hand deliver that paperwork to the governor's office, and 99.9% of the time, the members that we move forward and recommend to the governor's office are the members that actually become a director on the Ohio Board of Nursing, which is nice to have that kind of pool with the legislature and with the governor's office. And it works, wonderfully on that connection with the Board of Nursing and with a professional association. I also should mention that the Ohio Board of Nursing is here to protect the public. Sure, you have to deal with a Board of Nursing if you want to be an RN in the state of Ohio. They give you your licensure, and that's who you pay your money to when you take the NCLEX and have to renew your license every 2 years. ONA, of course, we want to protect the public as well, but we're here to make sure that we're protecting our profession as well. The ORC is the Ohio Revised Code, and the OAC is the Ohio Administrative Code. So the ORC is the statute and laws that have been passed by the legislature, and the OAC are rules set forth by state agencies, like the Ohio Board of Nursing. Every 5 years, the Board of Nursing has chapters within the Nurse Practice Act that are reviewed. And so I have two things start on here. Chapter 4, which is 4723, if you Google that, it'll pull up the Nurse Practice Act for the state of Ohio. And it'll tell you what you can and can't do as a registered nurse in our state. And then 4723-8 is the APRN certification and practice. So if you want to move on to become an APRN in the state of Ohio, I suggest Googling that as well. So people within the process, who are the leaders, the influencers? What do they know about healthcare? What do they know about nursing? What do they know about your particular issue? What experiences have they had with the healthcare system and nurses? What is their background? And what are their legislative priorities? So we already know that in the General Assembly, there are currently no registered nurses serving in the Ohio House or the Ohio Senate. So how do they view nursing if they're not already a nurse? Did they have to take one of their significant others to a hospital? What was their engagement with a nurse while they were there with their significant other? Did they have a really great experience? Did they not have a great experience with their nurse? That all plays into how they view our profession. So within the process equals people who can influence legislators. So because our legislators are not experts in nursing, it's extremely important for registered nurses to be at the table to explain to legislators what nursing really is like and what it's like to be at the bedside, what laws and rules need to be changed or adapted to make our profession better and to make the healthcare system better. So why should nurses care about health policy? Well, hopefully by me explaining that we have no registered nurses in the Ohio General Assembly, hopefully you can see why it's important for us to speak for our own profession and to be the experts of our profession. We're a regulated profession in a regulated industry, and nurses tend to get involved at the implementation stage, and that's nobody's fault. You know, you graduate from nursing school, you have student loans you're trying to pay back. You may decide to go on to get an advanced degree. You may have a family at home that you're trying to take care of. You're working 3 12-hour shifts with maybe trying to pick up extra shifts here and there. You're busy. But what that means at the implementation stage is that a law is passed with the legislature. It trickles down to the Board of Nursing. The Board of Nursing sets up rules, and then those rules then go to the various hospitals and facilities. And that's usually where you get something new that you have to abide by, or you see something that ONA posted, a new law that you have to abide by, and you're like, wait, that's not really what I think is the best thing for the profession of nursing. Well, at that point, it's too late unless you go back to the legislature and try to work through the process. Really, we'd like to get nurses involved throughout the process, in committee hearings, speaking to legislators, so that it's not waiting until the last minute at the implementation stage to make sure that we have a voice. And if nurses don't speak up for our issues, others will, and we may not like what they have to say. So do you think that the physicians have their own association and lobbyists? What about the pharmacists, the physician assistants, the APRNs? Everyone has their own lobbying group, and they are speaking up for their issues, and so nurses need to be there to speak up for our issues as well, so that we have a voice and we're not relying on other groups to speak for us. The window of opportunity is now because healthcare reform will be opening many doors for nurses. So we're seeing the shift in healthcare where we're moving some of the care out of the hospital setting and into community-based care. And that's not a bad thing. It's just knowing that that's happening and being involved in the process to make sure registered nurses are out in the community, taking care of our community, and not other groups who may not be as educated as we are. Nurses are skilled individuals in communication and education. We are taught in nursing school how to speak to our patients, how to teach them a new technique, to teach them about their medications. So it's taking that ability that you already have instilled in you and educating your legislators on what it means to be a nurse and what it is when an issue arises. And nurses are the healthcare experts. We're at the bedside 24/7. So we are the ones who know how something may affect our patient care or our profession. Now, a little bit about what ONA does. Within our health policy department, which is one program that we have within our association, I like to think of it as a 3-pillar program. We've got our lobbying, we have our political contributing entity, and we have our health policy council. And I'm going to talk a little bit about each of them in more detail. So lobbying at the State House, there are 2 lobbying components at ONA. We have our direct lobbying, and we have our grassroots lobbying. Our direct lobbyists, we actually hire a firm, and their office is directly diagonal from the State House. One of our lobbyists has been with ONA since 2000. He's not a registered nurse, but he knows an awful lot about nursing after working with us for over 15 years. He's very effective. They share their knowledge with the legislature, and they bring back information to ONA to say this is what they would like to do with the law. and then we can provide information from the nurse's perspective. Again, they have direct access. They're so close to the State House. They're in the State House every day that the legislators are there. The grassroots lobbying is the action taken by nurses and other concerned citizens to demonstrate their support or opposition for an issue. So that's all of you. And you don't need to live in Columbus to be an advocate. You can advocate back in your districts when your legislators are in the district. And everyone is a special interest group. That means you. Again, you're a regulated profession in a regulated industry, and so that means that you're a special interest group. I wanted to point out the numbers that I have in red. With the RN license renewal every 2 years, the Board of Nursing has begun to ask specific questions related to you as a registered nurse. So once you graduate from nursing school, or if you've already graduated from nursing school and you're advancing your degree, you will see that they ask specific questions like, what specialty area are you working in? Do you have a BSN versus an associate's degree? Do you have an advanced degree beyond a BSN? What type of setting are you working in? Do you have the need or the want to go back to school? All of those questions are now included within the license renewal process. And what the Board of Nursing does is takes that information and puts together an Ohio workforce data summary report. So these numbers that you see on your screen are actually from the 2013 Ohio Workforce Data Report. And they put that out in October of 2013. So we should be seeing new numbers come October 2015, since we just went through a new license renewal. You can actually download those reports from the Ohio Board of Nursing website, but as of 2013, there were 171,767 registered nurses licensed to practice in Ohio, and 11,473 APRNs licensed to practice in our state. And I wanted to pull up those numbers just to show you the impact that we could have if every single registered nurse in the state of Ohio met with their legislators. We could have a very, very powerful voice in moving our profession forward. Our political contributing entity works just like a PAC does, a PAC. So the ONA PCE uses $1 per member per month to support legislators of the General Assembly. So the reason why ONA has to call it a PCE is because we have a labor arm to our organization. 90% of our members, 80% of our members within our association are collective bargaining nurses who work in union facilities, and we represent them. And because of that piece of information, the Secretary of State's office says that we need to have a PCE account and not a PAC. That's just a little helpful tidbit. But members can also opt out of having their $1 per member per month put into the PCE account if they wish. And that money is given to, again, supporting the legislators who support nursing. Our Friends of Nursing are the ones who get the funds from ONA. Elected officials receive contributions who support ONA's legislative agenda and who are there for us when we need them. We are usually one of the top third, fourth, or fifth largest contributing entities during the election cycles. And that's important to know as well. So not only do we have a voice at the State House with the lobbying and with ONA and our members being involved, but we also have the funds to help back our voice, which is always important in the legislative and election process. The Health Policy Council is currently made up of 16 ONA members, 2 of which are ONA Board of Director members. Those members are put on the council from our Committee on Qualifications I had mentioned earlier in the presentation. And as a part of that, they're appointed to the Health Policy Council every even-numbered year to correspond with the General Assembly. So they're appointed in even-numbered years, but they start when the new General Assembly starts. So we got a brand new Health Policy Council in January of 2015 when the new General Assembly came on board. They can serve 3 consecutive terms. So that means they can serve 6 solid years back to back. And then some of them will take a break for 2 years and then come right back on to the Health Policy Council because that's what they're passionate about. HPC makes recommendations to the ONA Board of Directors regarding legislative priorities. So say it's a contentious piece of legislation, the council will look at the legislation, make comments, questions, concerns that we may go back and ask the legislators or other interested parties. And then we'll bring all of this information to the Board of Directors, and then the Board of Directors will vote on whether they think they should support or oppose a piece of legislation. If it's not a contentious piece of legislation, which pretty much is what it usually is, the Health Policy Council will be the voice of ONA. So it's not just me making the decision on behalf of all registered nurses in the state of Ohio. It's not our lobbyists. It's not our CEO. It comes directly from our membership. And they are the ones who look at legislation and make the recommendations on whether we should support, oppose, monitor, become an interested party on any piece of legislation that relates to nursing or healthcare in Ohio. We also have an affiliate organization program, which is a group of specialty organizations that build a relationship with ONA and help build a network for the nursing profession. So, for example, some of our affiliate organization programs are school nurses, oncology nurses, emergency room nurses, advanced practice registered nurses, and they can all become an affiliate of ONA, and we can help build those relationships in knowing that nursing is stronger in numbers and we can help each other out when we need to. So collaboration. Politics make strange bedfellows. Today's enemy may be tomorrow's best friend. We cannot afford to make enemies. So what that means is, for example, oftentimes we are in conversations with the Ohio State Medical Association, OSMA, or the Ohio Association for Physician Assistants, or with the Ohio Hospital Association. And we may not always see eye to eye on specific issues, but we have that professional relationship built with them that sometimes there is a time when we can collaborate on issues to make the healthcare voice stronger in our state and to make a powerful statement to work together. And again, nursing strength is in numbers. That's why we have an affiliate organization program, to build nursing's numbers to make us that much stronger in our state. And coalition building with other groups. So we've sat on various task forces with the Ohio Department of Health, an opioid task force within the General Assembly, direct care workers group that took place after the 2013 budget process. But it's just really trying to make sure that nursing is at the table in any conversation related to healthcare or patient care so that we can make sure that our voice is heard for our profession. How can nurses get involved? Again, you have to accept obligation, but it's important to be involved in advocating for us and for registered nurses. You can connect with other nursing organizations, again, some of the specialty nursing organizations that are out there. You can reach out to your own lawmakers. If you don't know who your legislator is, it's very easy to find out. You just go to ohiohouse.gov or ohiosenate.gov. You type in your zip code, and it'll pull up who your legislator is. Reach out to them. Let them know that you're a registered nurse and that you want to help them work through and be the expert on nursing issues. Offer your expertise. Keep going back. Communicate regularly with them and help with elections. Help build that relationship with them. And share information with colleagues. Make sure that if you find out about a new law that's been passed in Ohio that affects our profession, make sure you share it with people that work on your unit or that you have connections with. Again, know your representatives and senators. Vote and be an educated voter. Know what's happening during the election cycle. Connect with your peers who share an interest in policymaking, and model the behavior to peers and colleagues. It's that whole idea of excitement is infectious. So if you're excited about something, you're probably going to get other people excited about it as well. What can you actually do to get involved? There are several different ways to connect with legislators. You can write a letter, maybe make a phone call, send an email, attend one of their fundraising events, or a coffee talk that they may be having where they want to meet you and learn about what you do. So if you're going to write your legislator, make sure that you follow some of the helpful tips. Be personal. Make sure that you let them know that you're a registered nurse. Stay on message. Show statistics. Evidence-based research is great for the General Assembly. They like to see numbers. It has a long shelf life, so if you write them a letter about a specific piece of legislation, they can put it in a folder and have that to look back on when it comes time to vote. Be concise, informed, and polite. The best way to get your message across is to be polite and share statistics. Be brief. State your position in the first paragraph. So if you're writing your legislator, not only mention the House bill or the Senate bill number that you're referring to, but give them a brief description on what that piece of legislation looks like. The reason why I mention this is because there are hundreds of pieces of legislation that come through, and it's challenging for legislators to know all of the numbers directly off the top of their head. So if you can also offer a brief description on what the piece of legislation is trying to do, that is helpful to them to kind of tie the connection between the number and what you're going to be speaking about. Include your full name and home address. That allows them to know that you are a constituent in your district and you're going to be voting to keep them in the General Assembly or not voting to keep them in the General Assembly. And they're much more willing to listen if you're an actual constituent. Cite the bill number or budget item. Be factual and speak from your own experience, and ask for their views on the issue. Phone calls have some of the same benefits as letters. They're personal, they provide instant feedback, they're quick and easy, and they're great if you're shy. Now, I'm not sure if you're shy why you'd be going into the nursing profession, but it's great if you really are shy when you're first talking to a legislator. You can call after hours, after 6 p.m., and you'll get an answering machine. And then that message will be picked up by the legislative aide the next day. You can then pass your message on to the legislator. State who you are, why you are calling, what you exactly want from them, and always follow up with a note. And I actually had a conversation with Representative Dorothy Polanda at one of her fundraisers. And I told her that I speak to a lot of nurses and nursing students, and I said, we talk about advocacy, we talk about how to get involved. Do you have any kind of advice you can share from a legislator's perspective? And she said, absolutely. Tell them that handwritten notes are always seen before typed written notes or letters. And that's specific to that legislator, but just keep in mind that it's not often that we get handwritten notes. But Representative Polanda will actually take the time to read handwritten notes. They go to the top of her pile. She reads them first, and then she goes through the typed ones. So that's just a little side information from a legislator themselves. But again, every legislator is different. If you're going to visit with your legislator, whether it be in the district or here in Columbus, just know that your visit may be short. And it might be shorter than what you think it's going to be because legislators are busy. They're popping in and out of committees. They're going to a speaking engagement where they have to give a presentation. They might be going to a fundraiser. They may, there are just various reasons why the visit might be short. So have a 90-second version of what you want to say, and always include these 5 things: who you are and where you live, any group to which you belong, hopefully the Ohio Nurses Association, what you want to talk about, what you want them to do, and leave something in writing, again, for that solid evidence that they can put in a folder to remember you and remember the conversation. Paint a picture of who's affected. If there's a piece of legislation coming through that changes your scope of practice, that then in turn changes the way that you take care of your patients, paint that picture for them so that they can understand how it's impacting you and your patient care. Tell them how you will share the results of the meeting. You know what? This is a really great meeting, Representative so-and-so. I can't wait to get back to my unit to tell my friends that you're going to do X, Y, and Z. That's really powerful to know that you're getting the information out to others. And another way that you can get involved in advocacy and advocating for the nursing profession is to come to Nurses Day at the State House. And this is an event that ONA puts on every year. We have over 400 nurses and nursing students in the atrium of the State House year after year after year. And it's one of the largest events that the State House sees every year. And the legislators definitely know when ONA and our members are there. So we spend the day talking about issues that relate to our profession, pieces of legislation that each group is working on. We have co-sponsors of various nursing specialty organizations who speak on behalf of their association during our panelist sharing. And then we also invite the legislators to have lunch with us. So we will split the atrium into various districts, and constituents can sit with their specific legislator at lunch and share information and get to know the legislators. I should also mention that during the Nurses Day at the State House, the legislators are provided with the information that's going to be talked about at our Nurses Day at the State House. That information is delivered to them a few days before the event happens, just as another reminder to come down and visit with nurses from across the state. This past year's event was in February, and our theme was Nurses, the Heart of Ohio's Healthcare. And our next Nurses Day at the State House will be March 2nd, 2016. Here's a picture from this past year. All of the nurses from across the state. Now I want to talk a little bit about some legislation that's going through the State House and some things that ONA has been working on recently that relate to our profession, just so you can get a feel for why it's important to be involved in the process. So currently, ONA is in the process of developing a nursing license plate for our state. We don't have one. We're hoping to have this specialty plate very soon. So here's the license plate. You can see the logo Caring for Ohio, support nursing at the bottom. And we have the signed petitions ready to go. Originally, we thought we had to have 500 signatures to go to the legislature to ask for this to be approved and signed into law. But with the budget that just passed through on July 1st that took effect, we actually only need 150, and we have over 500, so we're ready to go. This summer, we're going to be looking for a sponsor of the bill. We're going to draft the language, and it will be introduced this fall when the legislators come back from summer recess. One question that I do like to answer about this, some people say, well, if I put this license plate on my car, does that mean that I have to stop at accidents? The reason, and if you really look closely, The reason why we have the logo the way it is and the support nursing at the bottom is nowhere does it say, I am a registered nurse. Friends of nursing, significant others, parents, daughters, sons, aunts, uncles, anyone can buy this plate in support of our profession. It does not strictly mean that you have to be a registered nurse to buy this plate. And so therefore, there's no way of anybody knowing whether the person is a registered nurse or not who's driving that car. House Bill 64 was the giant state budget that just worked its way through the General Assembly from January until June. Started off in the House and then had to go to the Senate and then it had to go to conference committee, and it was signed and again took effect on July 1st. There were some things that popped up within the state budget. There are always things that pop up within the state budget, so it's always important for ONA and our members to be engaged in the state budget process to make sure nothing's slipping through the cracks. One thing that was in the House introduced version of the state budget was language regarding unlicensed assistive personnel. And basically what they were going to do was allow UAPs to be given a scope of practice without being licensed. And hopefully that's alarming to you. I mean, you're going through nursing school, or maybe you've already gone through nursing school already, and you know how challenging it is. But you do that so that you can gain your licensure at the end. This would allow UAPs to basically be given a scope of practice without doing the schooling and the education and the tests. There were a lot of unknowns, but basically they wanted UAPs to be working in long-term care facilities and in the home and working on off of Medicaid waiver programs. So we were obviously not too happy to see this language included within the House version of the state budget. So ONA did testify at the House Finance Subcommittee and worked with legislators in the Ohio House to get the language removed from the state budget. When it went to the Senate did not include it back in, and so we were waiting to see what the conference committee would do, and it ended up resulting that we were successful in the removal of unlicensed assistive personnel language. It was definitely a win for nurses in the state. There was also the removal of changes made to independent provider language and removal of language that would have prohibited faculty members from joining unions. So those three things remained out, or they were removed from the state budget, and so we were successful on all three of those things. The one thing that we were not successful in was the addition of community paramedics. And again, when I had mentioned earlier model legislation that goes state by state by state, this is one of them. And we've seen it coming down the pike for 2 or 3 years, and we were just waiting until it was introduced in Ohio. It was not introduced in the Ohio House version of the state budget, but it was introduced in the Senate version, and so we continued to fight this language throughout the Senate version, the conference committee, and we also had drafted a letter to the governor asking for a line item veto when he signed the budget bill. We were not successful. Just as a little insight on what they were trying to do with this was allow paramedics and EMTs to use their scope of practice in non-emergent settings. So basically going into patient homes and taking care of them. We met with the community, we met with the Fire Chiefs Association, who also represent paramedics and EMTs, and we asked several questions of which they didn't specifically have answers to. Reimbursements. Currently, if EMT goes in and gets a call to see a patient and they show up and it's not emergent and they don't need to transport the patient, they don't receive funding for that trip that they made to that patient's house. However, with this new law, if the fire station chooses to do so and they send out an EMT to visit a patient and it ends up being a non-emergent setting, they'll be able to charge to have the reimbursement for that visit to see the patient in non-emergent settings. A lot of this is tied to that frequent flyer who calls the EMT or paramedics whenever there's an issue that they have. And again, we said, well, maybe they should be connected with, hospice care or home care nurses. And so we worked with the Ohio Council for Home Care and Hospice on this language. They got involved in the process, asked a lot of the same questions that we had, submitted letters to the committees just like we did. But unfortunately, we were not successful, and so there is the addition of community paramedics that was included in the state budget. We are going to continue to work through this process to see what the rulemaking looks like as it moves down the pike, but continue to look very, very closely at how this is implemented within our state. Senate Bill 110 and House Bill 96 are companion bills, but basically what it is APRN's delegation of medication administration. So this legislation would grant APRNs holding a certificate to prescribe the authority to delegate medication administration to non-nurses as long as the route of administration is not via IV and the medication is not a controlled substance. The APRN must be physically present at the location where the drug is being administered, and the APRN shall ensure that the unlicensed person has the knowledge, skills, and ability to administer the medication, which is also required by the employer themselves. The delegation cannot occur in an inpatient care unit of a hospital, freestanding, or a hospital emergency department, or an ambulatory surgery center. That's long-winded, but I'd like to give a scenario of what's currently happening in our state and then share what this bill proposes to do. So currently, if you have a child and you take them to their well child visit, maybe their 5-year well child visit, and when you take them in, you see a physician, and the physician says, yep, Johnny looks great, we're going to go ahead and give vaccines X, Y, and Z. So the physician leaves the room. Well, think about the nurse that's working in these type of settings. In primary care, we tend to see a lot of medical assistants working in these settings, not registered nurses. But in this instance, the physician can leave the room and delegate to Susie, the medical assistant, to give Johnny the vaccines of X, Y, and Z. And then the medical assistant can then go into the room and give the medication or the vaccines. However, if you're taking your child in, you're taking Johnny in for their 5-year well visit, and you're seeing the nurse practitioner says, yep, Johnny looks great. We're going to go ahead and give vaccines X, Y, and Z. The APRN leaves the room. The APRN currently has to either give the vaccines themselves, delegate to a registered nurse if a registered nurse is there, or pull a physician out of their current room and have the physician delegate to a medical assistant. Currently, APRNs cannot delegate to medical assistants because they're not RNs. So what this law would allow APRNs to do is to be able to delegate to medical assistants. And so that's why you'll see all of the very distinct descriptions in here. So nothing via IV, no controlled substances, nothing in an inpatient care unit or emergency or a surgery center. So that knocks out a lot of the types of settings. But specifically, what does that leave? Primary care. So it will allow the APRN to delegate to specifically medical assistants to give specific vaccines in those settings. Actually, we're very happy to announce that Senate Bill 110 had passed through both the House and the Senate unanimously and was signed by the governor on July 16, 2015. And it will take effect 90 days thereafter, which means October of 2015. APRNs will be allowed to do this. So this was a huge, huge win for the Ohio Nurses Association, the Ohio Association for Advanced Practice Registered Nurses, as well as the Physician Assistants Association and the Ohio Emergency Nurses Association. We all worked collaboratively on this piece of legislation for well over 2 years, and it's really nice to be able to announce that it has been signed by the governor and will take effect in October. Another piece of the legislation that I just talked about was Senate Bill 55, Physician Assistants, and basically what the physician assistants wanted to do was revise the law governing the practice of physician assistants. So it would change the terminology of certification to license, would contain provisions that authorize PAs to write prescriptions as long as they hold a master's degree or higher, would increase the number of PAs a physician can supervise from 2 to 3, and they had the exact same delegation standards that we had within our Senate Bill 110. And so what happened was during the last General Assembly, both the two bills that I just spoke about were in the legislature but didn't make it through the legislative process in time, and so they had to both be reintroduced. And so the legislators were familiar with both pieces of legislation, and so we rolled Senate Bill 55, the one that you're looking at now, into the previous slide, Senate Bill 110, and they moved through the process together. They were amended. So the Senate Bill 55 was amended into Senate Bill 110, and so it passed the House and Senate unanimously with our piece of legislation, and we were so thrilled to be able to work together on this issue to have safe delegation standards within the now law. Something else really exciting that has just taken place is that Representative Kalanda has introduced House Bill 216, the APRN Modernization Bill, or as you can think of it, full practice authority for the state of Ohio. So what this bill will do is replace the existing certificate of authority issued by the Ohio Board of Nursing that authorizes a registered nurse with advanced education and training to practice as a certified registered nurse anesthetist, CNS, certified nurse midwife, or a certified nurse practitioner with advanced practice registered nurse license. It will also allow the APRN to practice without a collaborating physician, or in the case of an APRN who is a certified registered nurse anesthetist, without supervising dentist, physician, or podiatrist. So it will allow APRNs to work independently with their scope of practice. It will eliminate the requirement that the APRN, who is a clinical nurse specialist, certified nurse midwife, or certified nurse practitioner, enter into a standard care arrangement with one or more collaborating physicians or podiatrists and practice in accordance with the agreement. So there will no longer be a standard care arrangement if this were to pass through. APRNs can work independently, specifically the clinical nurse specialist, certified nurse midwife, or the certified nurse practitioner. If passed, this bill would also grant an APRN, including a CRNA, the authority to prescribe most drugs as part of the APRN license without the need for a separate certificate to prescribe or completion of a supervised externship. So currently, if an APRN wants to prescribe medications, they have to have this separate certificate to prescribe, a CTP. They have to go through a separate process to gain that in order to be able to prescribe medications. If passed through, this bill will also eliminate the drug formulary established by the board that specifies that drugs in APRN is authorized to prescribe. So currently, the way the formulary is set up for APRNs is it's exclusionary. So it lists all the drugs that the APRN cannot give. And it's page after page after page, and there's always additions made to that list. And so it's very challenging for an APRN to keep on top of the drug formulary the way it's set up. We are the only state that has this that way. So what they would like to do is eliminate the drug formulary established and to make it more inclusionary like other states. So where this bill currently stands is that it was introduced by Representative Palanda, and it has had sponsor testimony within the Ohio House Health and Aging Committee. And I do have to say that the day that this bill had sponsor testimony, there were over 250 registered nurses and APRNs at the State House to support Representative Palanda in her sponsor testimony. Not only did the amount of people fill up the actual committee room, but it also filled up 3 overflow rooms. And the State House is still talking about it, and legislators are still talking about what an experience that was. They've never had so many interested party members show up to hear sponsor testimony like that. So it's making a huge difference at the State House to show that nursing is taking this seriously, and then we want to move APRNs forward in our state. Safe staffing. Everybody likes to hear about safe staffing because it's important with our profession. I'm not sure if you know that Ohio does have a safe staffing law. It came from Substitute House Bill 346 of the Ohio 127th General Assembly. What the current staffing law for our state says is that each hospital shall convene a hospital-wide nursing care committee no later than 90 days after the effective date of this section. And the hospital shall select the members of the committee subject to the following. So the chief nursing officer, the CNO, has to be a member of the committee. At least 50% of the committee's membership shall consist of registered nurses who provide direct patient care in the hospital. And the number of registered nurses included as members of the committee shall be sufficient to provide adequate representation of all types of nursing services provided in the hospital. So the committee can't just be made up of all med-surg nurses or all OB nurses. It has to be a fair representation of each type of nursing services that's provided throughout the hospital. In accordance with this law, each hospital shall create an evidence-based written nursing services staffing plan guiding the assignment of nurses hospital-wide. The staffing plan shall be implemented no later than 90 days after the hospital-wide nursing care committee is convened. And that committee must meet at least one time a year to look at the staffing plan for that facility. The hospital shall also provide copies of its nursing services staffing plan to any employee of that facility. So you may be looking at this and thinking, well, there's no talk about sanctions, meaning if the hospital doesn't follow this, they don't have to pay a fee, which is correct. And what I like to mention here is that Ohio is the only in the country that does not license hospitals. So think about that. If you're not licensing hospitals, it's really hard to hold them and to have accountability set for them, because it's not like you can say, if you don't follow this staffing law, your license will be revoked. Some people say, well, why didn't you go for that? This staffing law was actually a combined effort between the Ohio Hospital Association and the Ohio Organization of Nurse Executives, the Ohio Nurses Association. Everybody worked collaboratively on this, and this was a step in the right direction. A lot of times, pieces of legislation have to start at the ground level, and you have to build and build and build until you get happy with the outcome in the end. So this was a baseline. It was introduced years ago, we're seeing that there is no teeth to this law, meaning there's no sanctions, there's no revoking of anything because the hospitals don't have license, or they're not licensed. And so we feel like it's time to go back to the General Assembly and say, look, this is not exactly doing what it was meant to do. So what can we do to change this legislation and to make it better, to have teeth in it? And so ONA, over the last couple of years, has been doing quite a bit of work. We've asked 3 or 4 times for each facility in the state to send us their staffing plans. We have several binders full of all of the staffing plans from across the state of Ohio. And we've started taking a look at these staffing plans, and what we're seeing is that, yes, they may be following the law, but is it really what they're doing within their facility? And the answer is not always. We have one giant hospital system that sent us their staffing plan. It's 3/4 of a page for a large hospital system in our state. And we're saying, how can a 3/4 of a page be a sufficient staffing plan? Well, come to find out from a nurse who works in that facility, they're doing far beyond what the law actually says, but what they sent us is what the law says to send. So yes, they have 3/4 of a page, but they have also developed committees within each unit of their hospital system. And so they're building staffing plans at each unit level, not just the hospital level itself. So it's hard to tell, what the hospital is actually sending us versus what's actually being implemented within the hospital. So ONA is going to continue to work with other interested parties to see how we can add teeth to the current staffing law. But I just wanted to make you aware that we do have one, and we will be building on that in the future, and that you can request, once you're employed by a hospital, to look at the staffing plan for that facility, and they must give it to you for free. What's to come for our profession in the future? Well, we have Medicaid expansion in Ohio, but what's that going to look like as our governor tries to become president of the United States? What does the extension of Medicaid look like? What is the future of the APRN modernization bill and scope of practice for registered nurses, not only at the bottom of the scope for registered nurses, but at the top for APRNs? And is everybody working to their full potential with their education and the training that they have? And what will education look like for nurses in the future as we move out of hospital-based settings versus community-based care? So I know I'm not able to really provide any questions with having a recorded presentation for you, but please feel free to take my contact information at the end of this presentation, and you can email me or give me a call, and I would be more than happy to provide some answers to the questions that you have. I do love this quote. I have children, so it's one of my favorite movies and favorite books, but unless someone like you cares a whole awful lot, nothing is going to get better. It's not. I hope you enjoyed the presentation today and that you become actively engaged in the profession of nursing and moving nursing forward. It's an exciting time to be a part of healthcare and health policy and making changes for the betterment of our patients and for our profession. And I thank you so much for sharing this presentation today. And again, please feel free to contact me if you have any additional questions or would like to be involved in ONA. We'd greatly appreciate it, and thanks again.